Joining us now, a thyroid disease survivor and healthy living advocate, Iroma Ofotube. Good morning, and thank you for joining us. I hope I got your name correctly.
Correct.
Thank you for joining us on TVC Breakfast. Now, talk to us about thyroid. What does hyperthyroidism, if that is what it is, what is it about? Talk to us.
Hyperthyroidism is just a kind of thyroid, but thyroid itself, let's talk about the thyroid gland. The thyroid gland is a butterfly-shaped gland that is located below, just below the Adam's apple. Everybody has a thyroid gland. And this thyroid gland has a very huge role it plays in the body. That's the whole body system, the organs, the tissues, the cells are connected to it for the whole body to function optimally. So it's the master gland of the gland that is responsible for the body metabolism. Let me just describe it like that. Yeah, it works with the brain, the heart, the digestive system, the guts, everywhere. So if there's any problem, if any problem occurs at the thyroid gland, it will affect the whole body, virtually the whole body.
Wow.
You know. So it could be hyperthyroidism, which when the body, it produces two hormones that are responsible for that metabolism. But when the hormones are overproduced in the body, you call it hyperthyroidism.
What causes those hormones to overproduce?
There are so many causes of thyroid disease. There are so many causes. It could be autoimmune. That is in a layman's language where the immune system begins to affect and attack
itself.
The thyroid gland.
Okay.
Yes, and some people can come up with hyperthyroidism, and we call it autoimmune because that autoimmune can affect the thyroid gland in such a way that it can be overproducing or underproducing. And another thing is those people that come up with iodine deficiency. Yes, there are so many, and it's hereditary.
Hereditary?
Yes,
okay.
It's hereditary. So a lot of things can come up, but scientifically, all these things, we're just coming up to find out exactly why this small gland can be just whacked and the whole body is wrecked.
So now you see it's connected to the whole body system.
It's connected to the whole body system because when the symptom comes, it starts from the brain. There are some mental, when we talk about mental illness, it's linked to so many mental illnesses.
So what are the symptoms?
Yes, like I said, there are different types.
Okay.
Hyperthyroidism has its own symptoms. The person can come down with weight loss. There's unexplained weight loss, like what happened to me. I had hyperthyroidism, but before then, you may be having a kind of some psychological, mental issues, anxiety, panic attacks, and depression.
Really?
Yes. Then you can come down with, you'll be losing weight unsolicited.
So how do you manage thyroid?
How you manage?
How did you manage to cope when it happened?
Okay, when it happened to me, initially, I want to mention something here. In Nigeria, not only in Nigeria, all over the world, is underreported because the symptoms mimic other health conditions. When you start having some kind of symptoms, you may attribute it to all these common diseases. Okay. Do you understand? Like then, I've always been on the big side. I was going to the gym and I thought I was just, but I was losing the weight rapidly. And fatigue, that's panic, that's palpitations. You walk from here to there, your heart begins to race. To race, you begin to pant. Fatigue, you cannot even, at times, somebody will discuss something with you. The next minute, the person asks you, you say, I can't remember again. Yeah, brain fog. So it comes with a lot of things, psychological and infertility too. Yes. You know, I told you it's connected to
all the body systems.
all the body systems. So it affects the female, both female and the male reproductive organ. But I will call it a kind of gender-specific disease because it affects women 8 to 10 times.
Okay, but as we, like you said, it affects women a lot of
more than
the men.
Yeah.
And you also mentioned earlier that there has not been enough awareness on the situation.
There has not been a lot.
Spread the word, because more like other diseases that people talk about, malaria and typhoid and the likes, even cancer. Yeah. Thyroid is underreported, like you said, and
yes.
The word has not been spread everywhere. How do we ensure that people get to understand what this is about?
And that is why my organization was established, to spread the awareness, and that's what we're doing today. I also want to appreciate TVC. They have always been there for us. Anytime we come up with all this awareness, media can help us. We do a lot of, then government can help us. Even some of our hospitals to help us to spread the awareness. You know, these days the disease is becoming too rampant. It's becoming too common. You know, when people only, you said something when you were introducing some people think it's only when you have goiter that.
Yeah.
There are so many people that have thyroid disease, but they don't have goiter. You can see somebody how you mentioned hypothyroidism. Hypothyroidism makes someone, it's just opposite of hyperthyroidism. When someone is, adding weight, putting on weight, no matter your effort, the dieting, the exercise, it cannot reduce unless you start treating it, but it is manageable and it is treatable.
All right, Iroma Ofotube, let's leave it here now. Thank you for speaking with us. Joining us now is a thyroid disease survivor and healthy living advocate, Iroma Ofotube. Thank you for joining us on TVC Breakfast. Now, talk to us about your level of assessment on the level of awareness of thyroid disease in Nigeria, and what do you think is hampering it being reported?
Misdiagnosis. Misdiagnosis, that is number one reason, because like I said before, the symptoms mimic other health conditions. So most of the times, doctors don't go in depth.
Does it mean they are not aware themselves? They do not have detailed knowledge about thyroid?
I would say it does not really occur to them because they don't really understand what this thyroid is causing right now. But the awareness is on. It doesn't really occur to them. Okay, for instance, somebody called me the other time and said, because of this your awareness, I had to press the doctor to recommend me for thyroid function test because I've been having these panic attacks, I've been having these palpitations, and he kept giving me, treating me for high blood pressure and all that. And remember that high blood pressure is an associated symptom, is one of the symptoms of, so they don't really go in depth to find out when a patient comes and complains repeatedly of one particular problem. They don't go back to check what could be the underlying cause of this. What we are pressing is to make thyroid function tests that is a staple test, diagnosis. When any patient complains of certain things, even some doctors, they don't come up to tell us that one of the causes of infertility is thyroid disease.
Now, talking about the thyroid function test, can someone, an individual, perform a thyroid neck check on himself, like examine it on himself?
Yes, you can. You can go to the mirror, stay in the mirror, just raise your neck, and someone can help you check. You drink water, swallow it. If you see something going up and down here, then you have to suspect that something is wrong.
Or it's not supposed to move in the first place?
No, it's not. It's not supposed to move. But once you check yourself, when you see something going up and down, or you see your neck enlarging in an unusual way, you have to call for medical attention. And most especially, like I said before, it's not everybody that has thyroid disease has goiter or enlargement of the gland. Some people will be suffering from other, maybe clinical, other internal symptoms of thyroid disease. Somebody may be having, okay, I was talking about that woman. She said that doctor told her after a repeated visit to the doctor that she had premenopausal syndrome.
Whoa.
And she wasn't getting better. And she told doctor, I've been reading this woman's write-up, let me go and check myself. I'm having panic attack. I'm having some similar symptoms, with what she always mentions. And she went, it happened that she has hyperthyroidism.
So how does treatment come? Is it when you check it early that you can treat it quickly, or how does it happen?
First of all, we encourage people. We always say that early detection, it goes a long way to help. When we encourage people, especially women, to always go, even if it's once in 6 months, to go for a thyroid function test. It is treatable, especially when it's diagnosed at that early stage. Yes, it is treatable, and even when it's, because it does not just come and kill like that. It kills. It kills? Yes. It doesn't just come and kill like that. It's something that may be in your body for a very long time. Before that, I don't know whether that is why they don't really talk about it, because maybe doctors must have tried out many options and now say, let's do thyroid function.
But you know what? When you talk about going for tests once in 6 months,
yes.
But when a situation or a state like Lagos where everyone is gearing to go, there's traffic everywhere, everyone is trying to make ends meet, thinking about going for a thyroid test doesn't readily come to mind. So how is your organization pushing for such a situation where people go for tests regularly?
Okay. Well, first of all, what I did, because part of my challenges when I had this disease was locating where to do the test.
Okay.
Not all hospitals have
Not
that.
all labs, and some of them may do it and may not do it well and get the right values. So first of all, the first thing I did was to approach a digital diagnostic center. Number one is for the reason of our accuracy, to get what we want, to always make sure it's a trusted diagnostic center. Then secondly, to give us a quality healthcare in an affordable rate. So now you can get to be tested on a thyroid at a rate you can always afford. Which is very, very, very different from what we used to have.
All right.
Yes.
Let's leave it here now. Iroma Ofotube, thank you for educating us on thyroidism.
All right, it's Thyroid Awareness Month, and of course we have joining us in the studio our thyroid disease survivor and healthy living advocate, Iroma Ofotube. Thank you very much for joining us. All right, looking at this now, how do we deal with the stigma? Because I know that you were there, and you would have faced some sort of stigma at one point. So how do people who have thyroid handle it? How you deal with the stigma?
Is it how do people that have the thyroid or people surrounding them?
Everything altogether.
Okay. Well, it's something that the victim herself or himself cannot even help. But people around, surrounding, like colleagues, bosses, siblings, even parents. I have seen a girl of about 26 years that came to me and said one day her mommy was just angry and said, I don't know whether this thing you're carrying, whether a man will even marry you in this. That kind of thing with, coupled with someone that is always, switching into depression and anxiety. It's just that, like I said before, thyroid disease, the best thing that will happen to anybody is to get diagnosed. Once you know what is wrong with you, you'll be able to know how to manage it.
Now, as a healthy lifestyle advocate, talk to us about the kind of lifestyle for persons who have, discovered that they have this, stick with to ensure quick recovery from this. And also, if those who haven't discovered, what kind of lifestyle they should, be dealing with now.
Because of the huge role the thyroid gland plays in the whole of the body, it is our collective responsibility to make sure that we have a healthy thyroid gland. Yes, there are some things, there are some lifestyles, smoking,
Okay.
too much alcoholism, and there are some minerals that are very,
fizzy
very
drinks.
essential. Yes.
Okay.
And we should avoid all these sugar, carbonated drinks, that all those things that kill the body, because once they hit, there is all those things that, you know, immune system is in the gut.
Yeah.
A larger percentage of it is in the gut. So when your gut is okay, your immune system will be at peace. There's no way it can act weird. So another thing is, people that have thyroid disease should try as much as possible to eat food like, you know, avoid something like soy, anything
Okay,
soy.
okay. Soybeans.
Yes, avoid it. Then it depends on the type that one is suffering.
Okay.
Yes, like someone that has hyperthyroidism, you know, there are people that will tell you that their thyroid is an iodine deficiency,
Yes.
and they'll be bombarding themselves.
With iodine.
Or people will be, all these people that sell supplements. That is the problem. Let me point it out now.
Okay.
You know, the problem we have is ignorance. Somebody seen goiter on me, or you have goiter. You don't even know the type of thyroid disease that caused the goiter. And goiter is one symptom they have in common. And every type of thyroid disease has its own specific treatment.
Okay.
So if you have hyper and you're taking something that a hypo patient should be taking, that means you're bombarding yourself more with more thyroid hormones. Yes, you will not be getting. So the first thing, the fundamental thing is to
Diagnosed.
Get diagnosed, and don't go and borrow. What did you take? And all these supplements, some of them recently, in a 10-year-old, they sent all the supplements, including the ones that are harmful to her. And her situation was getting worse before they started looking for me. So when we are taking supplements, we should be very careful and even seek our doctor's advice before you take anything. Thyroid disease is a condition. Once it's there, you have to be careful of what you eat, because and another thing most autoimmune thyroid disease, when you leave gluten, you know what is gluten? You find it in whole wheat.
Yeah.
When you leave it, you will get better. Those are the things, when your digestive system is okay, you will get better. Your immune system will be at peace.
All right.
Yeah.
All right. Thank you very much, Ifeoma Oribe, for talking to us on this.